If you have Medicare Advantage and you're moving abroad, there's something your plan doesn't tell you. Stay outside the US for more than 6 months. Your plan disenrolls you automatically. No warning, no letter, just gone. But here's the thing. That's actually the least expensive mistake you can make. The one that costs you real money is different, and almost nobody explains it clearly. 3 decisions. This video. Right answers. Before we get into it, if this is the kind of content you need, hit subscribe and the bell. We put out 1 video a week on exactly this stuff, the financial decisions Americans have to make when they retire abroad. It is free, and it might save you a lot of money. Now let's get into it. If you're planning to retire outside the US, Medicare is going to follow you in ways you didn't expect. Not because it covers you abroad, it doesn't. Because the decisions you make about it before you leave determine what you pay every single month for the rest of your life. 3 decisions. Each one has a clear answer. By the end of this video, you will know exactly what to do with each one. Decision 1. Part B. You're moving to Portugal. Medicare Part B costs you $202 a month. It covers doctor visits, outpatient care, medical equipment, and it covers all of that inside the United States. In Portugal, $0 covered. In Mexico, 0. In Panama, 0. Anywhere outside the US, 0. So the question every expat asks is, why am I paying $200 a month for nothing? Here is why. If you drop Part B while you are abroad and come back to the US later, the government adds a 10% permanent surcharge to your premium for every year you went without it. Think about what permanent means here. Not 5 years of penalty, not until you pay it off, every month, for the rest of your life. Let me put numbers on this. Sarah is 62. She is a software engineer from the Bay Area. She is moving to Porto next year with her husband. $900,000 in her 401k. Plans to stay 10 years. Sarah drops Part B. $202 saved every month. Over 10 years, that is $24,000 in her pocket. But at 75, she comes back to Arizona. She calls Medicare to re-enroll. 10 years without Part B, 100% surcharge, $202 times 2, $405 a month for life. She saved $24,000 over 10 years. She will pay an extra $2,400 every year going forward. In 10 years, she has paid back everything she saved, and she keeps paying. At 85, she is down $48,000 compared to if she had just kept Part B. And here is the part that surprises almost everyone. That penalty is not a fixed dollar amount. It is a fixed percentage applied to whatever the premium is that year. In 2026, 50% surcharge is about $100 extra per month. If the premium rises to $230 in 2030, that same 50% becomes $115. By 2035, it could be $135. You do not lock in a dollar penalty, you lock in a growing one. So what do? If there is any chance you come back to the US, keep Part B. $202 a month is not health insurance abroad, it is penalty insurance for when you come back. If you are certain you will never return to the US as your primary residence, dropping Part B is a legitimate choice. But be honest with yourself about that word, certain. Because if you change your mind at 80 because of a diagnosis or a fall, the penalty will have been compounding for 15 years. Decision 2. Medicare Advantage. If you have a Medicare Advantage plan, Part C, you need to know this before you leave. Medicare Advantage plans require you to live inside their service area. That means inside the United States. The moment you establish permanent residence abroad, you are technically required to disenroll from your plan. But here is what catches people off guard. If you do not disenroll yourself and you stay abroad more than 6 months, Medicare can disenroll you automatically. No warning, no letter. You just get moved back to original Medicare. Most people chose Medicare Advantage because it bundled everything together: dental, vision, hearing, lower out-of-pocket costs. It felt like an upgrade. Abroad, it becomes a liability. You lose the bundle, you go back to original Medicare, and now you are paying Part B for coverage that still does not work where you live. The move. Before you leave, disenroll from Medicare Advantage on your terms. Return to original Medicare. Then make Decision 3. Decision 3. This is the one that actually keeps you protected. Medicare is not going to cover you abroad. So what does? You have 3 options, and most expats end up combining 2 of them. Option 1. Private international health insurance. This is what most expat retirees use as their primary coverage abroad. Companies like Cigna Global, AXA, Allianz Care, they offer plans built specifically for people living outside their home country. Full coverage, doctor visits, hospital stays, chronic conditions, emergency care. A couple in their early 60s in Portugal can expect to pay somewhere between $400 and $600 a month combined. That is real coverage for where you actually live. Now, you might have heard of Medigap, Medicare supplement plans. Some of them offer emergency coverage abroad. 80% of costs after a $250 deductible. Sounds useful, but read the fine print. First, it only covers the first 60 days of each trip. If you live there, you are not tripping, you are residing. It does not apply. Second, the lifetime cap is $50,000. $50,000 sounds like a lot until you need cancer treatment, or a hip replacement, or a cardiac event. That cap can be gone in one hospital stay. Medigap is built for tourists, not residents. If you are living abroad full-time, do not rely on it as your main plan. Option 2. The local public health system. In Portugal, legal residents with a D7 visa can access the SNS, the national health system. It is real, it is functional, and it is low cost. Waiting times for specialists can be long, but for primary care it works well. In Mexico, IMSS is available to legal residents. In many countries across Europe and Latin America, the local system is genuinely good and dramatically cheaper than anything in the US. Option 3. Out of pocket. In Portugal, a doctor visit costs between $20 and $60. In Mexico, many procedures cost a fraction of US prices. Some expats, especially those in good health in their early 60s, choose to self-insure for routine care and carry international insurance only for catastrophic events. Most expats end up with a combination. Keep Part B as penalty insurance, add a private international plan for actual coverage, and use the local system for day-to-day care. That 3-layer approach gives you real protection without overpaying. Here are your 3 decisions, one more time. Decision 1. Part B. If you are coming back to the US at any point, keep it. $202 a month is cheaper than a growing lifetime penalty. Decision 2. Medicare Advantage. Disenroll before you leave. On your terms. Do not let it happen automatically. Decision 3. Real coverage abroad. Do not rely on Medigap. Get a proper international health plan. I have linked Cigna Global in the description. They are built for exactly this situation, and they are who I recommend. Get a free quote before you leave. Takes 5 minutes. And if you want to go deeper, next week I am covering Social Security abroad, what you actually receive, what the government can reduce, and the treaty that protects Americans in Portugal and Mexico that most people have never heard of. Subscribe so you do not miss it.